Hello, I'm Michael George, an assistant professor of rheumatology and epidemiology at the University of Pennsylvania. I'm glad to be able to share information about abstract 0468, Concerns and Health-Related Behaviors During the COVID-19 Pandemic in Patients with or Without Autoimmune Rheumatic Disease in a Large Physician Network, presented on Friday, November 6th at the American College of Rheumatology annual meeting. This study is part of a broad effort by the Autoimmune Research Collaborative to collect information about patient experiences, concerns, and healthcare interruptions during the COVID-19 pandemic. We have been collecting data from patients who are part of several patient-powered research networks and those who are part of online communities like Creaky Joints. In addition, the data in this abstract comes from a large rheumatology practice network in the United States of more than 250 rheumatology providers across 27 states. Because patients with autoimmune conditions are at increased risk of infections in general and may be at greater risk of severe COVID-19, we wanted to understand how the concerns, social distancing behaviors, and healthcare interruptions compared in patients with autoimmune disease compared to other patients seen in a rheumatology practice. We received survey responses from more than 18,000 patients in this rheumatology practice network, and we identified within that two groups of patients. One group of about 7,000 patients with common autoimmune conditions like rheumatoid arthritis, spondyloarthritis, and lupus, and a comparator group of about 2,000 patients with osteoarthritis or osteoporosis. We were surprised to find that concerns about COVID-19 and social distancing behaviors were actually quite similar in the patients with autoimmune conditions compared to those with non-autoimmune conditions, after controlling for things like age. Although healthcare interruptions were common in both groups, patients with autoimmune conditions were less likely to avoid office visits and more likely to use telehealth, perhaps because their conditions required closer follow-up. We were concerned to find that more than 1 in 10 patients with autoimmune disease had stopped one of their treatments because of concerns about COVID-19, most commonly without discussing with their physician. These results help us recognize that COVID-19 concerns and disruptions in healthcare are having large effects on patients with autoimmune disease, but also those with non-autoimmune conditions in a rheumatology practice. This project is ongoing, and we are continuing to collect data as the pandemic continues. A key takeaway from what we've learned so far is the need to ensure that patients have access to rheumatology care, especially for vulnerable populations, and that we are communicating with patients about the importance of continuing their medications.